Hi, my name is Alex Malouf, and I am honored today to interview Dr. Mukta Panda via our Wellness Wave. Thank you so much, Dr. Panda. How are you doing today?
It's a pleasure to be in conversation with you, Alex. It's sunny after many days of rain in Chattanooga, so it's really nice.
Do you mind sharing with our ACP audience a little bit about yourself and what you do?
Yes, so I am professionally a professor of medicine here at the University of Tennessee in Chattanooga, and I also function as the Assistant Dean for Wellbeing and Medical Student Education. I practice both in the inpatient and outpatient setting, and I am a grandmother and a mother to wonderful children and a one-year-old granddaughter.
Wow, it sounds like you keep very busy, even with your grandchildren. Do you mind sharing with us, how did you choose your career path in medicine?
So I've taken what I say, the scenic route to the scenic city in Chattanooga. I trained in internal medicine residency here. However, I went to medical school in India, and both my parents are physicians. Mother was med peds and my father's surgery. And I just was drawn to their profession and how they were so excited in what they did. So I always knew I was going to be a doctor. And when I finished medical school, I actually trained in obstetrics and gynecology first. I was drawn to the miracle of birth and the beauty of engaging with the mother and the baby. However, after many years of that, I realized I was seeking some other kind of cognitive stimulation, and I loved OB, but I didn't feel fulfilled there. So I retrained in medicine here. And in medicine, I find the perfect opportunity to care for the patient longitudinally, but to care for the whole patient. And I love being involved in teaching and learning from our learners. So I love the academic portion of it too.
Well, thank you for sharing how you chose internal medicine from OBGYN and now internal medicine. But some of our students don't know yet what they want to do, both the medical students and our residents, that they're still trying to figure it out. Do you have any words of wisdom for them?
Yeah, so I think, and a lot of what I'm going to say is by hindsight. At my age, hindsight is even more 2020, I think. So what I really advise and sort of recommend to the students and even residents is to really be intentional about the rotations they are in. So there are few broad categories that you can think of. One, where do you feel that you are most connected? And where do you feel that you may be exhausted and tired, but you still feel engaged and excited to get up and come the next day? So what is it? Is it a specialty that really has a lot of procedures, or a specialty that is not that procedure heavy? So that's one sort of branch point, procedural versus non-procedural. And what I mean by non-procedural is not completely, but you could get procedures in some specialties too. The other is personalities, right? While we all have different personalities, there are certain type of personalities that choose certain specialties where we feel we can connect with more. I was just advising a third-year medical student yesterday, and he said, when I was amongst the radiologists, it was funny. Within 2 hours of being with strangers, we were talking about so many things. It was really exciting. So learn to trust that. So where do you feel you fit with the personalities of the people that you are with, the team? The next is pathology. What sort of pathology do you like, right? And pathology of the diseases. Do you like the adrenaline of the fast-paced trauma in the ER? Or do you like the slower pace where you can get to know patients better and then follow them longitudinally, not just in a small visit? Where do you feel fulfilled? What sort of, do you like children? Do you like pregnant mothers? So that is the pathology. Then the next one, I think, which is so important, is the passion.
Mm-hmm.
Where is it that you feel connected? So the P's, the procedure versus non, the personalities, the pathology, but the passion. Where is it that your soul lights up? So how can we learn? How do we learn to get to that? So what I advise is on every rotation, think about, and same for residents, when you're doing different specialty rotations, think about 3 to 5 things, at least once or twice a week. Be intentional of writing them down, penning them down with reflection. What was it that energized you about that rotation? Where did you feel energy, where you felt you were at your best and you felt like you were connecting your passion to your purpose, what you wrote about in your personal statements, you were fulfilling that. And even if you truly like something, be forced to think about what is it about it that you don't like. So it comes with reflection and being intentional, and that may guide you.
I love that paradigm of seeing it with the P's, personality, procedure, passion, pathology. That's super helpful. And so I just want to shift our conversation to the topic of wellness. First of all, a question we have for you is, how do we generate a toolkit to manage stress?
So each of us are very different in how we manage stress. So it always comes up with knowing who we are and what really, what are our buttons that trigger that response in us where we feel stressed. When now stress manifests in very different ways, right? In the severe fear or stress, we have our innate human response of fight, flight, or freeze. But other things are also the subtle responses. I start sweating in my hands. Right now, I'm a little anxious of where this is going, so I can feel my hands getting a little moist. So I know that about myself. And I'm psychologically taking a big deep breath and saying, reframing that it's going to be okay. So knowing that. So a self-check-in, and there are actually, templates and toolkits to really have a little self-check-in card, which I actually carry in my pocket and share with the residents and students, to remind them of them. So knowing what is it that stresses you. Once you know that, then you can start finding ways to address it. The one most important thing that I remind myself is to replenish myself. And what does that mean to me? Is I know my triggers are, if I get too hungry, angry, lonely, or tired, I need to halt. So I know that I'm not at my best. So I need to make sure I have snacks all the time. And then I offer permission to the students. I actually carry a bag where I have small bits of candy and some crackers. And I'm known as, they keep saying, hey, Dr. Panda, where's your candy bag today? So I carry it around, the nurses and all, just as an invitation. We don't get time sometimes to have proper meals, but replenish. Making sure that when I get angry, and angry maybe for things that I feel need to go some way and it's not, or I feel I'm not being listened to, how do I reframe that? And say, okay, now, for me it is take a big deep breath and really listen and turn to curiosity and wonder. And try to explore why are you feeling like this, and understand why they may be saying this. Or when a patient, you try to tell them again and again to stop smoking and stop drinking. Sometimes I feel like, come on, you've had your third heart attack, but I'm like, understand now I come from a place of compassion and empathy, but that's a learned practice. Tell me a little bit, how can we help you? Do you understand that this is harming you? Why do you smoke? So, and then I feel compassion. I don't feel anger. Making sure that I'm surrounded by relationships that are meaningful, so I'm not lonely. And then trying to get restorative sleep. That's really helpful for me. So that's one thing. The other thing is having a ritual, something that energizes each of us. We know what it is, whether that is playing with our pets, that may be spending time with music, going for a long walk. For me, my ritual starts in the morning. I find if I can wake up in the morning with a smile on my face and be intentional about offering gratitude. And we know so much literature on the wonder of gratitude. So I really offer gratitude and claim gratitude for 3 good things that are going to happen that day. And then I offer gratitude at night again. So that is my one ritual that I have maintained. The other ritual for me is taking time to reflect and pray. So that has always energized me. So, what is that ritual that you do for yourself that energizes you, and finding and then being kind and say, I can't do that. Say, I can't go for a walk every day, but maybe I'll try to do it 2 days. So, planning ahead, making a ritual of putting your own self on your calendar sometimes. That even though I'm on this rotation, I know surgery is very busy or medicine call, critical care is very busy, but this day I'm pre-call, so I will take an hour off to have a good meal or something like that. So you make that and look forward to that. The other thing is reframing. And reframing is I am my own self-critic all the time. I'm not good enough. I'm not good enough. Or that imposter syndrome we talk about so much, or the imposter phenomena is what I like to say, because it's not an illness. This is something that is influenced by so many things. So the imposter phenomena, and for me, one way to combat that is reframing and saying, but I did achieve this at that time. So I can do this. So being positive, giving myself that positive, realistic affirmations is very helpful. The other thing that is reflection. So the reflection is intentional. It can be done in solitude or in teams. So every week, at least once a week on my team, when I am with residents and students, we take time to reflect. And it's 3 questions that I pose to them. In our work together or in your life, as we've been together, what gave you hope? What gave you meaning? And what surprised you? What inspired you and gave you hope? What surprised you? What gave you meaning? And we are sitting down, we are talking. I've got my candy bag there. Sometimes we've got our mask, and we offer that safety of space. We offer that safety. It's okay to be vulnerable. That I share my own vulnerabilities. And then what happens is we realize that we are all together in the same thing, but we understand each other and we are listening. So that re-energizes us to move. So that's another way to take care of ourselves. And that reflection also helps us to connect with our why. Why did we come into medicine to start with? So those are some ways that I sort of try to take care of myself and self-check-in.
Dr. Panda, those ways are absolutely incredible. And I know for sure we will adopt them. I know I like the gratitude method that you do both in the morning and evening, and even on your teams, how intentional you are to bring, that culture of like reflection and positivity. So I really thank you for sharing that. I also wanted to ask you if you had a wellness quote or phrase that's your favorite that you would like to tell us.
There is one phrase that I got from my daughter when she was in middle school. And it is something very simple, and it is happy thoughts. And that's all about changing my mindset. And this was at a time when we didn't have videos or cell phones, and we lived about 45 miles away from the city where the children went to school, and I was working, doing my residency. So I used to carpool kids back and forth. So we had about 5 children in the car, and my daughter Natasha was sitting with her friend in the back. And obviously this friend of hers had not had a good day. There was something that was bothering her, and they were whispering, and she was upset and trying almost on tears. And suddenly Natasha goes, "Emily, just forget about everything. Just smile and have happy thoughts." And suddenly the whole tension in the car vanished, and there was laughter and singing. And I thought, a simple reframing with that thing, words of happy thoughts. So I use it all the time. And I've been gifted things from my colleagues that have little, postcards that say happy thoughts, greeting cards that say happy thoughts, a board, a placard. And then a few years ago, the residents gifted me a stethoscope on which the diaphragm, they've written happy thoughts. And that's the stethoscope on the cover of my book. So that's one well-being phrase. The other one that I'd like to share is one that really emphasizes the value of why self-care is so important, why well-being is so important for ourselves and to create and invite and offer that well-being for others. And that was by a dear friend and a very, very amazing writer and leader and activist, Parker Palmer. I don't know if you've heard of him, but if you haven't, I'd really ask you to look him up. And he talks a little bit about, and I'm going to paraphrase, he says, self-care is not selfish. It is the only gift we have to care for ourselves so that we can do and fulfill the purpose that we were put on this earth for. So I'd love to read it to you, but I know the gist of it. I don't have the exact words, but it's by Parker Palmer.
Both excellent quotes. Thank you for that. And I know you touched upon your book, and I know on top of everything you do, all of the hats you wear, you are an author and you wrote Resilient Threads. And would you like to share anything about that?
Yeah, thank you. So I really feel that we live our life in stories. Stories are powerful. They hold magic. They hold a power and sacredness. But more importantly, they are the seeds of who we are, who we strive to become, but more importantly, how we belong. And once we feel we belong, then we can thrive and be well. So if you think about it, our stories are unique, but they have universal resonance. I'm sure you've heard a story that connects with you, that brings you joy or moves you to tears. So the other thing I'm going to ask you to think about, what are you taught as soon as you get into medical school? You start your patient interaction with a history and physical. What is a history? Nothing but his story or her story. We are inviting a patient who, at the moment that we put out our hand and introduce ourselves, or now we don't even shake hands, we just introduce ourselves with COVID era, they are completely naked in front of us. Not just physically, but emotionally, mentally, spiritually, and it's such an honor. And if we listen to their story with intentionality, but more importantly, when their story connects with our story in some way, then that patient-physician interaction, partnership, and empathetic connection develops, right? So another thing what I teach and I try to model for myself is to, every time I listen and be in conversation with a patient or colleague or with you, I try to connect something about me and my life with with who you are. And I feel a different connection. And I think our life is made up of this connection of stories, right? And we thrive with that. So that is what prompted me to write this book. I wanted it to be a voice. And it's really, I look at it as not my book. It's a book of so many voices, a book that allows me to offer gratitude to who I am, my family, my culture that I was brought up in, my colleagues, because it is a community that has really helped me. And it's also a way to give voice to the women in academia, because they still exist the ceiling. And then I am an international medical graduate. I wanted to give a voice to the international medical graduates. So it was a voice of it was a book of so many voices. But the core crux of that book was the importance of 2 or 3 things. The importance of belonging, not just fitting in. When we truly can belong and we offer that belonging to others, then we thrive and we are our best. And we create that safety for people to be open and honest with each other. The second basic premise was about the stories and the importance of sharing stories. The third thing was on the importance of understanding that self-care is very important. We wear so many hats, right? Which I call the multiple hat syndrome. I'm coming to work. I'm a physician. I'm a preceptor. I'm an attending. I am a leader. I am a researcher. I go home. I'm a mother. I'm a daughter. I'm a friend. I'm a grandmother. Who am I? Am I going to take off and bring a separate person to each role? It's only when I can integrate who I am authentically into how I function as a mother, how I function as a teacher. If I don't lose my authentic core of values and care for those authentic core of values, that is the self, only then can I be at my best and not feel like I'm putting on a mask all the time and feel like I'm a fraud. And that to me is something else that I write about as to how we can do that. So what I tell students about how to really come to who I am is there are 4 words that are very important, not just for students and residents, but for us in life. So I can't take credit for all of them. This was in conversations like I'm having conversations with you. The 4-letter word, when I asked this, I asked the students, what is the 4-letter word that's most important? And I get all these giggles and everything. And I'm like, come on, guys, think about it. Not. The 4-letter word that is so important for all of us is HELP, help. And that was the wisdom of my son. He's a fellow now. This was when he was an intern. He talked about that. And I was really happy he mentioned that, how important it is for us to realize we are not alone. We cannot be alone. We have to be okay with asking for help. And people should be okay with us asking for help. And we need to create systems and culture that allow us to do that, whether personally or professionally. The most important 3-letter word is why. Why? What is our why? Why are we doing medicine? What is my reason for being who I am today? And that is reflection. Why do I want to be like this as a mother? How can I be there? What is my why of where I want to be 5 years from now? The 2-letter word is we. It is not about self-care and self-care and self-care alone. It is I and we, care for colleagues and care for self. So we have to think about us and not me alone. And then the most important word is I, the 1-letter word. That's because, like I said, if we don't give to ourselves, right? And I used to grapple a lot with this. Oh, self-care is so selfish. I'm altruistic. How can I get supposed to be selfless, right? It's counterproductive, right? If I take care of myself, I'm going to miss out on all these important work that I need to do. I don't have time to go exercise and go to the spa or go run or take my dog. I've got this, I'll miss out on this grant or this paper or something. It seems counterproductive. And we are working, which I bring up, our system is sort of rewarding the I also. We all know that we can't do a big study unless everybody's rewarded, right? But one person is the prime author who gets rewarded. So how can we reward a team? And I think we are looking at that now nationally. And then it's expensive. I used to think, oh my God, I need to take 1 week off and go to this resort and take care of myself and come back all rejuvenated. No, I need to weave that into every day with what I shared with you, the replenishing and reflection and rituals and things. So if I don't do that, I realized that if I didn't do that, if I didn't take care of myself, I gave to others, did not give to myself, I was exhausted. I was tired physically, emotionally. I was snappy. I couldn't focus. And I thought everybody else was doing well. It was me. And that imposter creeps in, right? And then you get that negative spiral and you get negative at yourself and you just feel like everything's falling apart. And that's when burnout happens. And you come from this place of depletion, then how can you give to others? But if you give to yourself, and you give to others simultaneously, then you're coming from this place of abundance because you have the shared wisdom now and everybody's thriving. So that's why I is so important. And for me, on the spiritual level, it is how I define that I, right? If I is something, a small, minute particle of a bigger power, supernatural power, whatever name we call it with, then shouldn't I take care of that flame, that light in me? So there are different reasons why. So those are the 4 words that I think are so important: I, we, why, and health.
Dr. Panda, those are words that we will all remember. And thank you for, touching upon these important themes and concepts, and that we should remember as we go through medicine, and taking care of ourselves so that we can take care of others and all the dynamics in between. Very beautiful. And I know from just listening to you in this interview, I feel very invigorated and very enlightened, so that I can continue helping others, and we all can. So thank you again for taking the time to share your words of wisdom with all of us, as we really appreciate it.
Thank you, Alex. And I really wish you all the best. You've got some really exciting times ahead, a new beginning of a new milestone in your life soon, right?
Yes.
Yes. Good luck. Good luck. And thank you for this opportunity. And more importantly, I applaud your innovation, courage, and commitment to this work. We need future leaders like you.
Oh, thank you. That means a lot. Well, I send you a big virtual hug your way.
Virtual hugs to you too.